Hi, everyone. I'm Eve Blackburn, Vice President of Patient Engagement at ACMCRN, the Arachnoiditis and Chronic Meningitis Collaborative Research Network. ACMCRN exists to advance knowledge through research and patient education, and to bring patients, caregivers, clinicians, and researchers together as one team. Today is about outreach and awareness, making sure the science and lived experience reach the exam room, the reading room, and the decision-making room. That's how lives change. I live with catastrophic adhesive arachnoiditis from a failed spinal fusion. Like many of you, I spent 18 years being misdiagnosed and dismissed through surgeries, implants, epidural corticosteroid injections, and complications. That experience fuels my work, creating spaces where patients are seen, believed, and equipped, and building tools I wish I'd had on day one. We grew from grassroots patient networks into a global patient-driven nonprofit. Early community builders, like Lori Verton, laid the foundation. We've kept that spirit, practical, ethical, collaborative. Before I go further, I want to pause and recognize someone who was instrumental in shaping our early path, Dr. Terri Lewis, a champion of patient-led ethical research. Her standards guide everything we do. And of course, we would not be where we are today without the steadfast dedication of another remarkable leader, Dr. Forrest Tennant. We are deeply grateful to Dr. Tennant for his clinical leadership, educational contributions, generous grants, and the tangible support he has provided to both our community and ACMCRN. With those foundations laid, let's turn to where ACMCRN is today, and the tools we've built to carry this work forward. Today, ACMCRN is shaping the future by uniting patients, caregivers, clinicians, and researchers in one collaborative hub. Our full name, the Arachnoiditis and Chronic Meningitis Collaborative Research Network, reflects what we do: focus on two overlapping, often misunderstood conditions, and bring people together through research, patient engagement, and community building. We believe information is power only when it's accessible, trustworthy, and shared. That's why our website, physician list, educational library, and support programs are designed to break through isolation and give people real tools. What makes ACMCRN different is that we're not just collecting information, we're building community around it, elevating patient insights to shape both care and research. This isn't just about better outcomes, it's about shared ownership of the path forward. Building community is more than a concept. It requires people taking action together. To make that happen, we launched the Arachnoiditis Awareness Collaboration Council, or AACC. If you run a Facebook group, moderate a patient community, or have a following on Instagram, TikTok, YouTube, or any other platform, this is for you. We know many of you are already doing the hard work of sharing information and supporting patients. The AACC gives you tools so you don't have to start from scratch. Here's how it works. ACMCRN creates the campaigns, the graphics, posts, videos, and educational explainers, and you can simply share them with your audience or group. That ensures consistent, accurate, patient-centered information spreads quickly and widely. Some members also help translate materials or design visuals, but at its heart, the AACC is about equipping influencers, admins, and moderators to amplify the right information. If you manage a group or already use your platform to raise awareness, join us. Scan the QR code or visit the link to join the council. One of the most requested and most visited resources on our website is our Arachnoiditis Aware Physician Directory. This is a curated list of over 215 physicians worldwide who have treated patients with arachnoiditis or expressed interest in learning more. We built this list because we know how hard it is to find a doctor who understands this condition or who's even willing to engage with it. Every physician listed has been recommended by patients with arachnoiditis. If you have a physician you would like to share, send their contact information to contact@acmcrn.org. A physician you would like to share, send their contact information to contact@acmcrn.org. Our website, acmcrn.org, is the heart of our work, a dynamic hub that evolves as we add new tools and respond to community needs. Here's what you'll find. Our starting point page includes Dr. Tennant's 3-component protocol and the emergency starting protocol, along with our educational materials and about arachnoiditis and treatment options section. We also offer the physician directory and our blog, filled with research updates and awareness posts. You'll find our events calendar featuring peer support groups, workshops, and curated programs, as well as our social media toolkit with ready-to-use graphics. And finally, Faces of Arachnoiditis, which highlights patient stories, and our community forum, a private space for secure discussions with other patients. Together, these aren't just pages on a website. They're building blocks of connection, so no one has to start from zero. And at the heart of all these resources is something truly groundbreaking: the International Arachnoiditis Patient Registry. This registry isn't just about collecting data. It's about building the evidence the medical community requires before new treatments are accepted and prescribed. For too long, patients have known which medications and approaches help lower neuroinflammation. But without data, doctors hesitate, insurers deny coverage, and progress stalls. That's why it is so important for people living with arachnoiditis to join the registry. Every participant adds to the critical mass of evidence by uploading imaging, medical reports, chart notes, and other relevant information that can push the needle forward toward treatments that work, protocols that get recognized, and maybe even a cure. Through the registry, patients join studies developed by our research team or in collaboration with outside researchers. Hosted on Digital Cabinet, a secure platform built for rare disease research, these studies are designed to uncover patterns in neuroinflammation, chronic infections, neurological complications, and long-term outcomes. The platform meets good clinical practice standards and international research ethics requirements, while ensuring that patients maintain full ownership of their data. Nothing is shared or accessed without their explicit consent. The registry is now being updated for relaunch, alongside 2 new IRB-reviewed studies on neuroinflammation and quality of life. We're aiming for launch by late September into October of this year. This is how we move from being overlooked to being studied, and ultimately, to building the evidence that can lead to effective treatments, and one day, perhaps a cure. The first of its kind, built by the very community it serves. To show you what's possible when patients come together, let me share one powerful example. We coordinated a 1,250 participant patient survey through Stuff That Works. It took months of onboarding and support, and it paid off. We presented a poster abstract from this study at 7 international conferences in 2023. To view it, scan the QR code or visit the link on this slide. The findings highlighted symptom patterns, triggers, and treatment impact, directly shaping upcoming IRB-approved studies. This project proved that when patients share their experiences in a structured way, the medical community pays attention. And that kind of impact is only possible because of the team behind it, a diverse group of researchers and clinicians working hand in hand with patients. We are now writing the manuscript for open access publication based on this survey, and will share it as soon as it's released. To be notified, sign up for our newsletter on any page at acmcrn.org. You'll also receive other important updates, including the grand reopening of our International Arachnoiditis Patient Registry. At the heart of ACMCRN's research efforts is a multidisciplinary team united by a shared goal: advancing rigorous ethical and patient-informed research for arachnoiditis. The team is led by Linda Bavisato, a seasoned clinical research leader with decades of experience in trials and safety oversight. We're also proud to include a physiotherapist with 30-plus years in care and public health, and 2 PhD candidates in epidemiology from Western University, one with a nursing and health statistics background, the other with expertise in public health and program development. Our group also includes 2 internationally trained physicians and specialists in oncology, infectious disease, immunology, and clinical trials. And importantly, our president, Lori Verton, contributes her own research background, and guides our collaborative strategy. This global, cross-disciplinary foundation allows us to approach arachnoiditis with both scientific rigor and lived experience insight. Together, we've presented at major conferences, contributed to publications, and are preparing new IRB-approved studies, with anticipated launches later this year. We're incredibly proud of this team and grateful for their shared commitment to a condition that has too often been overlooked. Of course, research is only one side of the picture. Just as important is the human connection we build with each other. That's why peer support is a core pillar of ACMCRN. We host regular Zoom-based support groups where patients share experiences, find encouragement, and connect with others who truly understand. One highlight is our men's group, led by Lou Cipher, which creates a safe space for conversations often overlooked in men's health. We also offer general peer sessions, along with guest workshops and special interest events, and we maintain a curated calendar of independent programs in movement, mindfulness, and resilience at acmcrn.org/event list. These meetings don't just reduce isolation, they restore agency, foster learning, and remind us we're not alone. We're always looking for more volunteers, especially those living with arachnoiditis, to help lead and expand this vital work. Everything you've seen today, research, outreach, and support, is built by volunteers. And to keep it going, we rely on community support. The International Patient Registry is fully funded, but sustaining and expanding our work takes ongoing support. Operational costs include website hosting, secure communications, design tools, and accessibility features, and we hope to grow into more support groups, translations, and outreach to underserved communities worldwide. We depend on donations to make that possible. Even small monthly gifts help us plan ahead and keep these programs strong. If ACMCRN's resources have helped you, or if you want to ensure others can access them, please consider becoming a supporter. This work belongs to all of us, and every contribution fuels the future. As we close, I want to leave you with what ACMCRN stands for: trusted, transparent, global. We're building something new, a patient-driven, professionally supported, internationally connected hub for arachnoiditis. Our mission is to advance knowledge through collaborative research and patient education, and our vision is to unite patients, caregivers, doctors, and researchers as one team. We believe in breaking down silos, sharing knowledge, and creating lasting infrastructure for everyone affected. None of this is possible without you. Whether you're a patient, clinician, researcher, or advocate, there's a place for you at ACMCRN. Thank you for your support and commitment. Together, we're not just raising awareness, we're building a movement.